Good morning, good afternoon, wherever you may be. And thank you so much for joining us today. For today's webinar, we have hypertension. Can we use technology to improve patient engagement? My name is Brianna Greer, and I am the program coordinator here at Hybrid Solutions. As many of you may know, Hybrid is Georgia's Health IT Center, and we have been assisting clinicians across the state of Georgia with federal and state incentive programs that promote interoperability through the successful use of EHR technology. We are located on the campus of Morehouse School of Medicine at the National Center for Primary Care. Our executive director is Carmen Hughes, and our executive medical director is Dr. Dominic Mack. Today's presenters are as follows: Phoebe Nelms, program manager here at Hybrid Solutions; Allie Bateman, quality programs manager at American Heart Association; and also Theo Harvey, the founder and CEO of SensorMed. So I'm going to turn it over to Phoebe Nelms, our program manager here at Hybrid Solutions.
Thank you so much, Brianna, and we're so glad to have all of you join us today for this important topic of why we should prioritize hypertension management as a focus in healthcare. So, as usual, we want to start out with the definition, although it's probably something you know. What is blood pressure? It's measuring the pressure of blood pushing against the walls of our arteries. And so hypertension, or elevated tension against those arteries, is measured in millimeters of mercury. And anything that's consistently high can be classified as hypertension. So a normal blood pressure should be less than 120/80. If it's elevated, it may be between 120 and 129 for systolic, and 80 for diastolic. And so hypertension, stage 1 or stage 2, meet these criteria as listed on our slide. Anything for stage 1, anything over 130, over between 80 and 89, or equal to or greater than 140 over equal to or greater than 90 is staged as stage 2 hypertension. Now, the thing about hypertension is that there are no signs, there are no symptoms. That's why it's called a silent killer. And so it's important that patients have their blood pressure measured, since that's the only way to know whether you have high blood pressure. So how prevalent is it? Almost half of the adults in the United States have hypertension, 45%, and that's 108 million adults. And yet only 1 in 4 have their condition under control. So high blood pressure was a primary or contributing cause of death for more than 494,873 people in 2018. So it's probably gone up since then. And it's not just a problem in our nation. It affects an estimated 1.39 billion people worldwide. So when you think about those statistics, what do you think are the percentage of your patient population that may line up with these statistics? These are some things to think about. Maybe there are patients who are undiagnosed. Maybe they come in for something else. And then we have the opportunity to help them manage this chronic condition. Because it does have some pretty serious impacts on health outcomes. It's related to, if it's not controlled, high blood pressure can lead to heart attack, heart failure, stroke, cognitive decline, kidney disease or kidney failure, vision loss, sexual dysfunction, microvascular disease, peripheral artery disease, problems and complications with pregnancy. So it's very important to recognize the impact and try to provide an intervention. And although risk increases with age, adults who have hypertension before age 40 are at even higher risk of having a cardiovascular event later in life. So early intervention can head off the development of additional chronic conditions and therefore mitigate their cost to the healthcare system. So, got a quick question. Why, based on what we just talked about briefly, why should we prioritize hypertension management? We'll just give you a couple seconds to submit your answers. Um, you know, over the last year plus, we've all kind of been preoccupied, understandably, with COVID-19. It's been like that big bad bully that just took over the playground. um, and so other things may have gotten pushed back in the background. But it has also highlighted how important it is that we address underlying conditions. So let's talk about some of those tools that can help us um, focus on hypertension and thus make a difference. Poll results. All right, all of the above. Thank you all so much. So moving on, what are some of the tools that we can use to employ or undertake improvement in hypertension management? Well, I really like this example here. It's first, you have to accurately measure. And so I think we can all agree that that's a first step in diagnosing and then treating high blood pressure. It begins with getting an accurate measurement each and every visit and at other times as well. And I really like this concise reminder resource from the American Medical Association, because if you post this up in your office, it keeps these tips top of mind for clinical staff. The week before last, I went to the doctor, had my blood pressure checked, and because I had been reading over this information ad nauseum, I actually had to remind the medical assistant to have my arm elevated. So even as a patient, knowing this information is very helpful to getting accurate measurements. I won't go into this in depth because our guest expert will cover this in more detail. But one thing I did want to mention is that the 7 things, how much they can impact the reading, I was really surprised to see that if you put the blood pressure cuff over a bare arm, you get a more accurate reading. If the cuff is over clothing, depending on how bulky the clothing is, it could add 5 to 50 millimeters of mercury to that patient's reading. So how important is it that we conduct the assessment accurately? So one of the other tools that we can use to focus on this chronic condition are the quality measures, because they provide valuable guidance and they also provide feedback. So quality measures, as you know, are standards for measuring the performance of healthcare providers as they care for patients and populations. And effective implementation of these quality measures by the clinician and the care team and the health system can lead to improvements in detection and treatment of high blood pressure for millions of people across the US, according to an article in the American College of Cardiology. So as the US healthcare system continues to transition towards a value-based payment model, patient outcomes will continue to impact reimbursements. And as we discussed in our previous slides, the management of hypertension, it can be a powerful lever in helping improve health outcomes for our population of patients. So what are these clinical quality measures? What are examples of them that relate to our topic today? The use of specific hypertension-related quality measures can help clinicians track their performance. And these measures are included in the quality payment program. I work very closely with the providers in Georgia who are eligible to report to the quality payment program. So this is a passion of mine. But they're also included in other value-based payment agreements. And so performance measurement, how you're doing in executing the guidance provided by the clinical quality measure can really give feedback, because the clinician can view, in most cases, on their electronic health record, a quality dashboard. And so by taking a look at that performance rate or percentage, it can give them feedback on a weekly or a monthly basis rather than at the very end of the year where they're having to report the information. If you look at it throughout the year, then you can identify areas for improvement, which can impact your score, your performance, which then impacts your potentially your reimbursement. And so we also mentioned ECQMs. What are those? ECQMs are quality measures that were developed specifically to allow your electronic health record system, which is certified by the Office of the National Coordinator for Health Information Technology, or ONC, um, a division under Health and Human Services. It's designed to meet their specifications or their standards to help you capture, export, calculate, and report the measured data. And these measures are available on the ECQI webpage for all to see. So in looking at these quality measures, controlling high blood pressure, preventive care and screening of blood pressure, tobacco use, body mass index, statin therapy, we can see how these measures can work in tandem to improve health outcomes. Hypertension, similar to diabetes or obesity, smoking, those are key unfavorable health metrics that can have really negative impacts on health outcomes. And so the idea behind having the measurement and the measures providing guidance is that they're tools. They work with human psychology. You know, human nature suggests that we're more inclined to improve what we measure, what we can visualize by having a beginning baseline and a goal, and then a way to assess that we've actually made progress. And so quality measures are tools that can help us achieve that. And again, anyone can access these detailed measure specifications that include the codes that are related, and even workflow diagrams on the qpp.cms.gov website. So how can we use technology? Because that's the title of the webinar today. Well, one of those things that we use to capture patient data is our electronic health record, and it can help us identify and analyze opportunities to impact patient outcomes. So by effectively using health IT uh, to assess how we're doing on these clinical quality measures, then we can actually be empowered with that information that's there. It's not just static data. We can pull it out, look at it, analyze it, and actually do something with it to impact our patient's health. So many times you can create like an in-house registry of your patients who have a certain diagnosis by running a report, so that you can then target those patients for interventions. And we all like real world examples. So I was speaking with a practice manager last week, and she shared that her goal for this year is to reach a target of 60 to 65% blood pressure control across her practice. So how was she going to do that? She was going to use the report functionality of her EHR to identify patients who would be most in need of attention. And of course, running those reports pulls together their diagnosis and uses claims data and so on. So what she would do after identifying those patients through the report is to then reach out to them, to get them into the office, to talk about, well, how are you managing? What are the barriers or challenges you're running into regarding your medication adherence? Are there community resources that we can connect you to help you to be successful? And also, very important, is establishing a follow-up schedule to keep in touch with those patients. And then we have the example of Dr. Edwards. Dr. Edwards recognized that regular office visits with patients were eaten up by clinical work, and that her patients with high blood pressure needed extra attention. So her practice staff used her EHR system to identify patients with a body mass index of 27 or higher, And then they sent letters to those patients asking them to come in for a special appointment. Now, of the 100 patients that took her up on the offer, they got a 40-minute visit with Dr. Edwards, and they set up, we set up on a day when she normally wouldn't see patients, and it would be completely focused on weight loss, nutrition, and exercise. And so Dr. Edwards used this time to give her patients information about where they can safely exercise in the community, and participating patients could come back to see Dr. Edwards every 2 weeks for a weigh-in, and every 2 to 4 weeks for a 20-minute discussion on their progress and challenges to losing weight. So making time for those short appointments with at-risk patients now can help prevent longer appointments and worsening health problems later. And she says it's been really productive because the patients recognize that we care. And when the doctor is focused on them individually, they're encouraged to take action. Dr. Edwards said, when they're in the office for their 20-minute visit for their blood pressure or diabetes, I don't have time to go over that. But when I set the time aside for 20 minutes to just focus on weight loss, we've been able to take people off medication, and we've seen improvement in their labs. So it's always good to see how the application of these ideas we talk about actually impact clinician satisfaction and also patient outcomes. So another tool that practices can use are standardized treatment protocols. And treatment protocols can really help identify patients who are eligible for clinical management and reduce variations and disparities in care. There are also, of course, clinical decision support rules that are embedded in the electronic health record. They can be a great support to standardizing care. They can also be customized to assist the practice in capturing data that's related to their selected protocols. And of course, we have to remember that the ability to generate accurate reports is in part based on the consistent entry of data in the correct discrete field so that it's searchable and can generate a report. And we want to acknowledge the hard work, the sacrifice, the dedication of our clinicians in acquiring the knowledge that they have and in using their experience to ultimately determine the best treatment plan based on the needs of the unique patient in front of them. So clinical decision support is an aid and support to the clinician, and in no way diminishes their impact on the outcomes. So moving along, today we are absolutely pleased to have as one of our guest experts, Allie Bateman, and she is the Quality Programs Manager for the American Heart Association. And we're so glad to get your input on this important topic. So Allie, you have the floor.
Awesome. Thank you so much. Good afternoon, everyone. Again, my name is Allie Bateman. I am a project manager at the American Heart Association, but are known as AHA. I'll probably use that in short language just to make it not a mouthful. I work in their quality department, specifically under the outpatient services. And one of my roles is to help outpatient sites and clinics around the country with our Target BP program, providing customer service, engaging them in the platform that we use to control hypertension. So I will be speaking on that today, as well as touching on a few resources that we have for free online for anyone to use if they are interested in learning more about blood pressure and or how to control blood pressure in their own site. So obviously the most important thing is measuring accurately when it comes to blood pressure. Blood pressure variability happens in everyone. It's not an anomaly. It doesn't have a specific person or type that they go after. It really comes down to human error and just life in general when it comes to taking blood pressure. Varying phenotypes when it comes to blood pressure obviously is well known as white coat syndrome, or it could be as easily as drinking coffee that morning or coming out of rush hour traffic. It really has a lot of effects on a person's blood pressure, more than you would think. So when we dive in today, I'll kind of go into the reasoning behind that. But honestly, when it comes down to measuring accurately, those are just the little things in life that kind of impacts it. Another thing is single office-based measurement. So when you go in to take your blood pressure, obviously you all have gone to physician appointments before, and you sit down. Usually the first thing they do is take your weight, your temperature, and your blood pressure. And they usually only do it once, but honestly, they should take it more than once. I can just remember last week I went in for a physician's appointment. I just got out of the car. I just got out of rush hour traffic. I didn't eat that morning. I had coffee in me, and I sat down to take my blood pressure as soon as I got there, and it was a little high, and I knew just from self-evaluation that that was kind of high for me. At the end of the appointment, I asked my physician if he could take it again, and he did, and lo and behold, it was a lot lower. So just in that small instance, you can see kind of the differentiation in blood pressure just based on those small variables. And as you can imagine, thousands, millions of doctors' appointments happen every single day, and that's a lot of data points. So we have to make sure when we take blood pressure, it's the most accurate reading possible. And lastly, when it comes down to it, the reason why our blood pressure measurements are off in the data is honestly because of just skills and training and healthcare staff. And that's not a low diss to healthcare staff at all. It's busy days from 8 to 5. You have a lot going on. You have a lot of patients to see. So it's normal and human error that mistakes are made. So honestly, our Target BP program and the resources we provide is just a way to make it as easy and as efficient as possible, and just to make it muscle memory. So when your patients do come in, we make sure they're getting the best care as possible when it comes to their data measurement. Here you can see are just a couple of errors that exist when it comes to taking blood pressure measurement. So if we go off the example last week of when I was in the doctor's office, I think I could probably check each one of these errors in that single appointment alone. And as you reflect on your doctor's appointments, I'm sure you can reflect and see a couple of mistakes that are made. I'll just kind of point out patient related, example, caffeine. Device related, we all don't like going into a doctor's office and the device doesn't fit properly, or they don't have the materials to fit your arm. Or lastly, it could be procedure related. So when I was getting my blood pressure taken last week, my legs were crossed and I was talking to the physician about my vacation last week. So again, it just is just little things that you don't think would make an impact, but as you can see, the bottom stat, and I like to kind of call this out, says inaccurate measurement technique is common. In a systemic review, a large bias was associated with 27 out of 29 potential sources. That is crazy, but it's honestly believable when you look at all these touch points. So as we can kind of concur, regardless of the device or method, BP measurement accuracy relies on competence of the observer. So again, it kind of reflects back on kind of the healthcare person who is taking the blood pressure. What we've learned is training and skills assessment should include patient preparation and positioning. So it's really important how that patient is positioned, making sure, again, that their legs aren't crossed, that their arm is at a 90-degree angle, and that they have a blood pressure cuff that fits properly. Obviously, obtaining representative results, that even comes down to how they record it in their EHR system. So early in this presentation, we heard how important data is. So for example, as they were recording that into the system, they have to make sure that they're representing the patient accurately. It can come down to race, ethnicity, weight, height. We have to make sure all those things are accounted for. And then obviously documentation and communication. If the patient is comfortable, they should know their blood pressure and they should make a point to note it when they're talking with their patients. The only way that we are going to get accurate blood pressure is to having those conversations with patients and making sure that they know their average blood pressure, and when they come into the doctor's appointment can call out when something's a little bit high, a little bit low, or some trends that they have been seeing at home for their own self blood pressure monitor. So again, it's really important for retraining of healthcare professionals every 6 months to 1 year. So I'd like to think of it as kind of like CPR training. If we're going off, the AHA life, you need to practice your skills as frequently as possible. If I told you one sentence today and in 6 months, I asked you to repeat that sentence back to me, most likely you won't be able to, because it's been a really long time. We're all humans. We learn a lot of information every single day. So it's really important that we reiterate and practice those skills and make blood pressure monitoring a daily, weekly, monthly practice, especially when it comes to those physicians and clinical staff that take it on a daily basis and have to take blood pressure measurements thousands of times a day, right? So we have to just make sure that everyone's well trained. So to kind of review, what can we do to improve the quality of blood pressure measurements? Again, use validated devices, calibrate when appropriate. I can't stress enough how important it is for staff to have the resources to take blood pressure, no matter the body type or size. If someone sits down and the blood pressure cuff is too big for them, we want to make sure we have access to a smaller cuff, or vice versa. So we have to make sure that we have valuable resources, and I know it can get expensive. Do not be afraid to kind of reach out to your local AHA market or affiliation, or look into free grant resources that provide materials to you for blood pressure cuffs. We get sponsors every day trying to donate money to us to buy these blood pressure cuffs. So please, please, please reach out to us, and we can kind of help you with those materials or provide you with resources to get access to those funds to make sure that your clinic or site has enough resources to do accurate blood pressure readings. Again, correct measurement technique. We are busy people. We have to make sure our staff know what to do when it takes blood pressure measurements. So just making sure we continue that training. And lastly, perform the proper number of blood pressure measurements. Going back to the example of taking it not once or twice, sometimes I've seen clinicians do it 3 times in a visit. It really just kind of depends on the scenario and space and the patient. But again, just because they read your blood pressure once, let's say it's 117/90, doesn't mean in 1 hour it's going to be 117/90. A lot of things impact blood pressure, so we have to make sure we're taking data over and over and over again in order to have accurate results. And I'm about to touch on why that's so important. So in partnership with the American Medical Association, the AHA and AMA have created a platform that's focused on managing hypertension, and we call it our Target BP program. Now, this program is available for free across the country. It is nationally recognized, and I'm going to chat a little bit about what it is and why it's so important if you're a clinic or you're interested in participating in the program. So just to reiterate, the program was created in response to the high prevalence of uncontrolled blood pressure in the United States. As we know, lots of data represents and shows that blood pressure is the #1 thing that patients struggle with keeping on track or keeping in balance. So Target BP is just a tool for healthcare organizations and care teams to use to just track the data. I think it's really great that if healthcare organizations make it a priority to do accurate blood pressure readings. However, it doesn't go a long way if they're not tracking the data or have anything to show for all the efforts that they're doing on a day-to-day basis. So I could be speaking to you today and you can say, yep, we do that. I know we follow this protocol, we train our staff. However, if I ask you, well, do you track that in any way? Do you have a data platform that shows that you're doing it accurately? And they say no, then it's kind of hard to believe, right? Because you have to show proof in the numbers. As a science-based organization, we take kind of pride in those registries and platforms, and this is just a simple way to do it, and it's absolutely free. Who doesn't love free registries? So again, this is just a target-based registry that is focused on recognizing how to control target BP in your own ecosystem. And again, thousands and thousands of outpatient sites across the country participate in this, and we pool data on a yearly basis, and that's kind of how you're tracked. So when we pool the data, we actually put it into a recognition program. So as you can see to the right, there's kind of 4 statuses that you can get if you qualify when it comes to the data with Target BP. So we have a gold status, we have gold plus status, we have silver status, and then we even have a participant status. So even if you pull your data and let's say it's COVID-19 year, it's 2020, you know, things happen, life is crazy, we just didn't have time to focus on our blood pressure measurement compared to all the other priorities at hand, that's okay. We still want to recognize you for trying. We still want to recognize you for committing to the BP mindset and for taking action and trying your best to target your patients and keeping them on track with your blood pressure. We were really nervous this year, obviously, because of COVID-19, of the data pool. The data pool happens every May. It's the Friday before Memorial Day weekend. what a lovely day to do that. Obviously a lot going on, a lot of people leaving for vacation, et cetera, et cetera. And we were super nervous to kind of look at those numbers. And we were pleasantly surprised that we had over 1,200 submissions in data. We were shocked. We thought we wouldn't even get 600. So just to see how dedicated healthcare organizations across the country are to keeping their patients' blood pressure control is truly amazing. And the recognition program is a way to kind of talk about that and something to be proud in. So we really take pride in those health systems that choose to participate, and we love to give out recognition and call where credit is due. So a couple benefits of being recognized. Obviously, once you get your submission status of the year, you're giving a certificate based on where you fall in the quadrant. Digital award icons are gifted to those who are given an award status. So what that means is in like your email signature, or if you're doing a presentation somewhere focused on hypertension, or you just want to boast about your ability in your clinic space, you get to use some recognition logoing in that presentation. You get a designated toolkit to talk about it. We do have a marketing team dedicated to target BP, so they come out with some really cool stuff every single year that you can use. And then obviously this is the big one, national recognition, just in general, and also at our scientific sessions. For those of you who don't know, scientific sessions is kind of like the Super Bowl of the AHA and scientific world. It happens every November, and that is a place where physicians and clinical leads and quality leads around the world come together, either virtually or in person, to celebrate the scientific success and research after a year. So as you can imagine, if you're an outpatient site in the middle of small town Georgia, your name could be put up there to be recognized, to be talked about, and to really take a moment to glorify how important it is to believe in the AHA mission and science to control your hypertension. Because as we know, high blood pressure leads to other comorbidities like high cardiac issues and or stroke issues. So I just want to focus on the MAP framework and the algorithm that we use going into a clinic. So let's say your clinic or outpatient sites wants to focus on improving blood pressure. Let's say you've done online resources and you're still having a hard time getting your patient population controlled. We can actually come in. The American Medical Association does something called MAP framework, where it just takes 3 strategies to control your work. So actually they will go in and analyze what kind of you're doing wrong and provide consultation services on how to get better. They focus on 3 things to improve. The first one is measure accurately. So making sure that your staff is just taking blood pressure control or taking blood pressure measurements accurately. Act rapidly, which means once they figure out a problem or once they figure out kind of the missing link of why you're not really controlling your blood pressure, they provide consultation services immediately. So it's not 6 months later or 8 months later, you get an email saying this is what you need to do. It's literally day of, where we could be in person giving you that consultative feedback, or we can do it virtually. And lastly, partnering with patients. The number one important strategy, other than making sure you're taking accurate blood pressure readings, is educating your patients. They are well knowledgeable to learn how to take their own blood pressure. They can learn why blood pressure is important, what it can lead to, why hypertension is an issue. So we want to make sure that they're just educated and they can go home and take their own blood pressure reading and teaching them. So once you kind of master internally how to fix your issues, we want to make sure we relay that to the patients and they can go home and have a positive impact. And when they come in next time to your clinic, everyone's on the same page about hypertension. They know their numbers, they know what to be looking for, and they know how to improve and taking those healthy lifestyle choices back to them at the home. So this is just a couple examples of how to do self-assessments when it comes to your outpatient clinics. Let's say you're not really ready for the MAP framework. You're not really sure you kind of want those in-person consultation services. You're kind of just getting your feet wet in the blood pressure world, and that's totally fine. You want to make sure that you're ready to kind of jump into the MAP framework. It's a big commitment. You can do self-assessments. So these are online and provided to you. You can just go into your clinic and kind of go through the questions and have brainstorming conversations and open, transparent conversations with your clinical staff of things that you're doing. Just taking a pre-assessment. It goes all the way into what technology you're using, what blood pressure cuts you're using, how you're recording data, et cetera, et cetera. Again, these are found to be extremely helpful for clinics across the country on just trying to get the same page for your blood pressure management, and honestly, just kind of opening up your quality journey when it comes to hypertension. So we're going to dive a little bit into online education resources for you guys that I want to make sure everyone has access to and that they know is available for them to use or to pass on to their staff. So this is my favorite slide because it provides all the great resources and online free CMEs that the AHA AMA offers to you guys when it comes to target BP. I'll start with our quick start guide. So essentially this is how to teach people to take their blood pressure at home, how you explain it to a patient, how you explain why it's so important, the history behind it, et cetera, et cetera. I use this on a daily basis when talking to outpatient sites. I've even gone to a clinic near me in Dallas, Texas, that has this hanging on the wall. So it's really great for clinical staff to use and to pass around when they're trying to make it a mission to teach their patients on how to do self-monitoring, because we know it starts not only in the clinic, but at the home itself. The next one that I really want to emphasize is the race and ethnicity data collection essentials. This is a great resource to use when you're trying to learn how to identify a person's race or ethnicity and translating that into the EHR data. So obviously when a person comes down, they can fill out on the sheet their race or ethnicity, but we want to make sure that we do it accurately in the EHR system. So the questions that you need to ask, kind of the workflow of making sure we're identifying the patient in the best way possible and the best way they want to be representative. This is the first and little step that we can make towards the quality and equity in the outpatient space. We want to make sure this resource is well known and accessible to all patients and clinics across the country. So please go online and check this out. It is extremely important, especially if you're a data abstractor or if you just want to learn more about how to identify this in the EHR space. And lastly, virtual and education training. This is national and regional webinars that are free. I will emphasize that and underline that 3 times. It is a free CME. So we all love continuing education credits. Again, this is online to learn just basically how to improve, to measure blood pressure accurately and the steps that you need to take. This is where it would fall into retraining your staff every 6 months to 1 year, and making sure that they're just getting trained constantly and learning the new science, guidelines, et cetera, coming out of the AHA and AMA. So here's just a little sample of the tools and resources online. I know we kind of saw the left infographic a little bit earlier in the presentation, but I just want to reiterate it again. This is something as simple as you can put in your staff break room. You can even put it in the actual clinic offices. It's kind of up to you. I've seen a lot of physician and clinical leads just put this in their pocket to make sure that when they're taking blood pressure, they're doing it accurately. I've seen it on walls and pointed out things that they're not doing and used that as kind of a patient advocacy effort of saying, hey, I need to be sitting here. My legs need to be this way, and you're not doing any of this. So please help me get to that. Okay. So don't be afraid to use that as a patient or as a clinical lead. It's super important. For those of that like to learn more visually, there's videos that you can use. So to the right, we have the self-monitoring blood pressure video. This is one of my favorites because I'm not a huge, infographic person or sitting down with the trifold. I like to actually see the video. It's much easier. So you could play this in the break room. You can play this in the patient waiting room. Again, just to kind of re-emphasize proper blood pressure takings. And it is also available in Spanish, which we love for our Spanish speaker patients and clinical staff. Again, and lastly, I just want to point to the online e-learning modules. We all love an e-learning module. As an AHA employee, I take thousands of these throughout the year. And for someone who takes them all the time, this is probably one of the best ones coming out of the AHA AMA. There was a lot of resources that went into building this e-module. I like to kind of represent it as a video game. So it's actually super interactive. It's not just you sitting there listening to a PowerPoint presentation or like reading, a 5-chapter book. It's actually fun, interactive, quick, easy, and digestible. So again, if you have staff who need refreshers, this is a great online resource that they can use. And it launched just in November 2019. So it's fairly new in its infancy. And we really push people to kind of take it. So we've kind of gone from like a little just simple infographic to an actual interactive e-learning module. So again, here's just kind of what it looks like from a visual learner standpoint. As you can see, it's super interactive. It involves clicking, typing, doing practice eSIMs. If anyone's ever taken a CPR course through us, it's very similar to our CPR courses. Again, just to reiterate, it is free, it is online, it is accessible to all those who want to use it. And last but not least, I just want to put in a little bit of a plug for a huge project that I'm working on. So we are offering a free registry pilot program to those healthcare systems who are interested in joining. Essentially, we will bring a platform that will take your EHR data and put it into a registry, and we will put measures up against that platform to show how you guys can improve, not only in the hypertension space, but in all outpatient quadrants such as diabetes, cholesterol, heart failure, you name it. And it's a free pilot registry. So we're just looking for 10 healthcare systems across the country to participate. I think we have about 5 or 6 signed up right now, so we still have room to invite more partners. There is a good ROI from this program. The biggest one is you get $25,000 free in stipends and grant funding, so that's really great to know. Also, you get access to the registry 3 years post-pilot, so in total of 4 years, you'll have access to this registry with your clinicians. And lastly, you'll be recognized at scientific sessions and just in general around that you are one of the founding fathers of our outpatient registry. So hopefully once this registry is launched and taken under pilot, we will launch this nationwide, and you can say you were part of that pilot process. So pretty cool. If you have any questions or want to reach out to me about any of this information, my email and contact information is provided in this presentation, and you can also just call me as well. But it was a pleasure speaking to everyone today, and I thank you for this time.
Allie, that was phenomenal. You get the Speed Speaking Award for the day. I was wondering how you're going to cover all of that, but it was great. It was so informative. So I would like to know, how can anyone that's interested sign up with the pilot registry? So maybe you can share that with me, and when I follow up to thank our registrants, I can include that information. That is phenomenal.
Absolutely.
That's a great opportunity. So thank
yeah,
you.
Happy to do it. Who wants $25,000? It's out there for grabs.
Awesome. And impact your patients in a positive way. That's win-win.
Exactly. Best
all
for both
around.
worlds.
Exactly. Awesome. So moving on, one of the things that was touched on in Allie's presentation was that patients could self-monitor and provide their information to their clinicians in various ways. And so education is a huge part of that, enabling self-management. And so using those tools that Allie mentioned that are available through AHA are great to support this activity with practices. A way to use the visit summary to provide teach back about their medications, appointments, and so on. And teach back just really helps ensure that the patient understands their condition, their diagnosis, the medical regimen you want them to undertake, their prognosis, or their treatment plan. So that's something we really want to help our patients with. Let's see, moving on. So we got one other poll question. Reviewing quality measures, creating a registry of patients that you use your EHR to pull or create with specific chronic conditions, as well as self-monitoring data from patients, can be useful tools to improve outcomes. And we know the answer. Absolutely true. We're going to move on, because the time has flown. That means we're having fun. One of the other things that helps with managing our patients is collecting data outside of the office visits. So we have examples here listed. There are remote patient monitoring services that are cellular connected to devices that collect patient data. We have other applications that can monitor health status so that it's connecting the patient to the care team. iHealth tracks and manages key health vitals and all in one place. There are patient portals embedded in electronic health records that patients can report their home readings to. And as Allie mentioned, taking blood pressure multiple times and having them taken in different settings gives more of an accurate reflection of what's actually going on with the patient's blood pressure. Another thing I want to point out is the value of health information exchange networks. Hybrid Solutions actually is a regional health information exchange. And so we can connect small ambulatory practices to the larger state health information exchange so that they can gather accurate patient history, medication records, medication lists, not only pull that information, but also share that information so other providers or other specialists have access to a more complete record of what's going on with that patient. So I would like to now, sorry, I got ahead of myself. I would like to now introduce our next expert guest. He has vast and extensive experience in healthcare technology and has actually designed a wonderful platform to help patients and clinicians benefit from remote monitoring. There are so many benefits that can accrue to the clinician, the patient, and even to the financial health of the practice. So it is my pleasure to introduce at this time Mr. Theo Harvey, the co-founder of SensorMed, to explain how we can do this.
Thank you, Phoebe, for the introduction. Hi, everyone. Again, my name is Theo Harvey, and I'm the CEO of SensorMed. We are a remote patient monitoring platform that helps patients and doctors stay better engaged. So purpose here is to kind of talk a little bit about the benefits of blood pressure monitoring. And so, we've been doing this for several years, over half a decade. We monitor over thousands of patients across the country. And so we have some great data we want to share today of why it's important to gather this information from your patients. Next slide, please. Yeah, so one of the things that we've seen as well, is that, the benefits to the clinician, just the visualization of trends, right? So currently right now, we have a target of about 750 patients that we're targeting, that we see their results over a period of time, right? We want to understand exactly, what is their baseline, for their, from a systolic blood pressure measurement, and how's that trending over time? And as you can see, the patients are lowering. What we found is from the clinician standpoint, patients tracking their data, paying attention to their readings on a consistent basis helps change behavior. I mean, it just makes sense, right? Because people change behavior if someone's watching. And so what we've seen, the data has shown, just with even in this first several months, we did it at the end of last year in December. I've tracked the latest data we have here for this slide is March 21st, but we have seen that trend continue even here in June. But the numbers are getting lower, right? The patients are seeing the results. They're understanding that, hey, if I eat this, if I don't work out, if I do certain things, I need to understand my numbers, and the numbers are helping me change my behavior. And ultimately, that's benefit to the clinician, because really it's about care of the patient and making sure they make better choices. And this is what, monitoring of the data have shown us. Next slide, please. And so what's the benefit to the patient, right? So we did a huge study with our thousands of patients to understand what's motivating them to kind of be monitoring these blood pressure monitoring, right? And so we found out 4 different areas, right? Motivation, right? These patients, expressed they were motivated just by health in general, right? To stay engaged and do healthy behaviors. They like the routine. Another focus group was said they like the routine, right? The stability, making sure they have a consistent thing they do every day, and it helps them feel stable about, hey, I'm doing something toward my health. Aware of health status. Some are just want to be aware on an ongoing basis of like, hey, if I'm monitoring myself, I want to make sure I understand what's going on. And the product and this type of monitoring can help the patients be more aware of their health status from a day-to-day basis. And then finally, the last group had kind of looked at, is it important for me to be monitored by others, right? Do they want like a caregiver or a healthcare professional to look at the data and understand what's happening with them, near real time? And if you go to the next slide, the survey results were overwhelmingly shown. If you go to the next slide, please, Phoebe. Yeah, next slide. I think there was a results slide there. I thought it was there. Okay, so yeah, so we had a results side. So if you go back to the other slide, apologize. So what we saw was that, yes, these are the 4 areas, and typically, monitoring by others was key, right? That was one of the bigger drivers, because they felt that like having someone there that cared for them to watch them understanding what their numbers were, so they kind of felt that awareness was really key for them to be successful going forward. So the benefits of patient is huge by being monitored with type of programs and solutions, especially when it comes to blood pressure monitoring. If you go to the next slide, please. And then continue, what makes these programs great is their sustainability now with reimbursements tied to remote patient monitoring, right? So if you're monitoring your patients remotely with blood pressure monitors, CMS has now these several codes, these 4 codes that allow for consistent reimbursable events for services you probably would have done anyway. So, and the unique thing about the technology now is all cellular based, right? So now you're looking at solutions that don't have to connect to a smartphone or a hub system, but can go straight to the cloud, right? It makes it a lot easier for some of your older Medicare patients to utilize these devices simply and easily. And more importantly, they don't have to constantly write things down in an old way in the journal, right? And all this information can be easily ported into the chart and their care plan. Next slide, please. And here's an example of a practice that just with 100 patients, what by enabling these, these type of devices, you can see the revenue can, yearly revenue can substantially make this program extremely sustainable, right? Obviously, right now you're in the early stages. There are some grants available for this and things of that nature. But how do you plan for the next, 3-4 years of these programs? And that's where these reimbursable models come in, right? Where you're looking at basically making almost 200K for just monitoring 100 patients, right? With these type of programs. So again, if you have any questions about that, please, reach out to us at info@sensormed.com, and we can definitely follow up and see what questions you have about the reimbursement sides of, blood pressure monitoring with your patients. So with that being said, I'll show briefly, my screen here so you can get a sense of kind of what does this look like, right? So like, imagine, if you will, these devices are being, sent over to your patients. And if I can share my screen here in a second. Yeah. So, this is kind of how the our solution works, and it can integrate into your EMR and to your systems and makes it simple. As you can see, you have all the information across your patients. But more importantly, what you want to see is trending information, right? Getting a sense of how the patients are trending on a day, month, or even a year basis, right? And we have a capability to monitor across all different demographics, where there's weight, blood pressure, scale, glucometers. So the goal right now is really blood pressure. But as you can see the trending data, right? And this is really important to kind of understand how the patient doing on a given day, right? And get the averages of what their blood pressure looks like. So that's really important, right? And this is also can be downloadable into a table format, so you get accurate information, or it can be easy to see in the trending information. Obviously, the goal would be trending and down to the left, right? To the right, excuse me, as your patients are constantly being monitored and making better choices. And all this is easy to can be downloaded in the form of a note system that can be easily integrated into their EMR or to the, or into their chart, so that you can see it on a consistent basis and see how the patients are doing. And so we try to make that as simple as possible for most of our clients when they're kind of engaged with this. And another thing too is it can be custom. So patients, were discharged from the hospital or something to that effect, you can be able to see the trending information, right? To see if they're trending in the right direction, or if they're likely to have an exacerbation. We did an extensive study with a large healthcare system in Middle Georgia, Navison Health, where we monitored COPD patients, and we were able to see with the trending data if the patients were likely to have an exacerbation and come back into the hospital. So those are some of the things that, is important, why monitoring is important and effective in making sure your patients stay healthy outside of the hospital and clinic. With that being said, I think I'll pass it to the next speaker.
Thank you so much. That was fantastic. I love the demo, the visualization that the clinician can actually see those trends, and what a dynamic tool to be able to monitor patients remotely. And also, it was great to see the impact on the revenue that's available to the practice for doing work, as you said, that they're probably doing already. So great reminders. We're all about health of the patient, health of the clinician, health of the practice. So thank you so much for sharing that with us. Now we have the opportunity, if anyone would like to ask any questions, we have just a few minutes where you can submit your questions in the question box or in the chat. And I really want to thank our presenters again. The information you presented, I'm sure the attendees will find actionable and practical. In utilizing the resources, I will follow up with an email as mentioned before with links to the resources that were discussed by our experts today. And if I can be of assistance in any way, please reach out to me as well. I'd be happy to support you in your quality improvement endeavors by sharing additional resources or answering any questions regarding the quality payment program. It's really a privilege to be able to impact in a positive way and support practices as they work to care for their patients. So let's see if we have a question here. Thank you so much for your commendation, and we wish you all the best of success and continued good health. Stay safe, and we hope you all have a wonderful afternoon, and come back and see us next time. So everyone take care. That concludes our webinar for today.